Good morning. I'm Ed Saunders from the Kidney Foundation, and today I have the great fortune of having the recent winner of the Kidney Foundation of Canada's Organ Donation and Transplantation Award, Nova Scotia Premier, the Honourable Stephen McNeil. Good morning to you, and thank you for taking the time to talk with us today.
Good morning, and thanks for inviting me.
And I must apologize. Yes, the background looks a little bit unprofessional, but a certain person has told me to stay the blazes home. So,
well, it looks fantastic to me. That's it looks like a working space, and I want everyone to be working.
Excellent. We appreciate that. The Human Organ and Tissue Donation Act came into effect January the 18th. And the people at your ministry has told me repeatedly that you've taken a great personal interest in this particular bill. We're all about stories at the Kidney Foundation. I'd love to know why this has been so important to you.
You know, it's something that I was actually thinking about even before I became premier. I had known a number of people who required transplants, and I'd always signed my organ donor card, and because I wanted to be part of the journey. But then I began to realize there were a lot of us were burying hope. A lot of organs that, even though we said we wanted to be to put our organs in as part of the system, a lot of times they were being buried with us. And part of that, as I started digging into it, really became about the conversation that was happening amongst families. So I went from the point of view that if we all said that we want to be organ donors, how come the question isn't then having us opt out? And we'll go with the principle, and the conversation then's easier for healthcare providers and families, loved ones. But as I started this conversation with healthcare teams in the province, I realized it was more complicated than even I was hoping it would be. Realized that the reason some of our organs were being buried was simply because we didn't have the infrastructure to make sure that where I live in rural Nova Scotia, that the healthcare teams would have that to provide that hope. And listen, it's as simple as this for me. There are very few times in any of our lives when tragedy strikes us, when our hearts are broken, that we can actually do good. And this is one of those times when, God forbid, that any of us and our families are struck with the deep loss that comes with losing someone you care about. But if it does, we then can provide someone else the gift of life. And out of that, it's an amazing, to me, it's an amazing part of the beginning to heal for the family who's lost somebody, and it's a new beginning for the recipient. So this was a win-win, and I actually thought we would have more opposition to it. It's probably why it took me so long to do it. But it was really, you overwhelmingly supported. There's obviously were concerns, and people had them, and rightfully so. But you know what? People wanted to give hope.
I wanted to ask you about that. It's very interesting that I was there in the day that you introduced the legislation, and the fact that, and this is a rare bird in politics for me, that all the opposition members and every member in the House seem to be excited about this opportunity. And I thought, well, how did you manage that?
Well, you know what? I think it was just it speaks to, I think, the desire of all of us to want to be part of giving hope. And I Margaret Miller's story is well documented, and about losing her son Bruce, and Bruce donating his organs and giving people hope and a new life and a new beginning. And I think all of us in some way, if not directly, indirectly, have been touched by somebody waiting. And we know what happens, all too well, 3 days a week. People who are waiting for kidneys, are going and attached to a machine and are gone all, 3 days, and out of their 7 days, and their entire life is planned around the machine. And we've all seen it. So I think what happened was, I think on that particular day, a lot of our minds went back to people we knew, some who were still with us and some who aren't, who were waiting. And I think we were probably all hoping and all wishing that this bill will actually lessen the wait, lessen the anxiety for those who are currently waiting today.
You mentioned, and I think it was important from the Kidney Foundation's perspective, that it's fine to announce a bill like this, but to make sure that there was a process in place, that adequate training and systems to make sure that organ donation and procurement was going to be handled successfully around the province. Could you speak a little bit to what you and your team have gone through in the past couple of years to make sure that this is in the place you need it to be?
Well, sure. When we came, I brought in Dr. Bede and his team who do the transplants here in our province, and I brought them in with this great idea I had, and they were very kind that particular day, the first day, and said, we like it, but in order for it to really be successful, we're missing some things, and in many cases, it's in rural communities, and it was adequate training for those healthcare providers in small communities, in particular. So I live in, like I said, I live in Upper Granville in Annapolis County. So I would be at Soldiers Memorial Hospital, the one in Annapolis Royal. My family would be known by not because I'm the premier, just because we live in a small town, and many of the nurses or doctors would know who we are, and it's just kind of the natural thing. So asking the question in itself in the old way was, is Stephen an organ donor? Is a hard one to ask someone you know and someone you care about, and how do you do that? So the question now is, Stephen is an organ donor. Can we continue? And then on top of that, leading into that, we prepared from an educational point of view, healthcare teams in those areas who recognize that when tragedy strikes, how do we make sure we preserve those organs? How do we preserve the body in a sense that we can harvest those organs to make sure they're still healthy as we move them into, in our case, Halifax, where we would be doing those transplants.
Just building on that, then what's for the future? You of course realize that an opto program is one part of a comprehensive organ donation plan. So how do you see the province investing in the future to continue building that healthcare infrastructure that can handle all aspects of organ donation and ongoing training and investment in organ donation teams? Where do you see the future investments in expanding on what you've done so far?
So what was really, and what has become really interesting for me, the investment isn't necessarily a lot of money. It was never, in particularly, we invest a lot of money here where the transplants happen. But in terms of investing, in terms of training, the whole issue around how do you support families who are going through that trauma, how do you support the healthcare teams, is not a lot of money. It's actually a mindset for the system to shift, and the educational component that we're providing into a system. And when you're blessed, in our case, in this province, to have somebody like Dr. Bede, who's so respected, around the world, to go out into our communities and talk to his peers, his healthcare peers, you start that momentum. We'll just start, and we'll still continue. It's my hope that we will be continuing to enhance the educational component and starting in having families have this conversation a lot sooner, because as I said to you, it's remarkable the number of Nova Scotians who want to be an organ donor. It's remarkable. The number is high here, but it wasn't computing sometimes with the number of donations. So this is a much different way of looking at it. It's almost how do you take the desire of our citizens and implement it into public policy? And this is what we did. So we took the desire of all of us wanting to be, not all of us, a good chunk of us want to be organ donors. So now you're opting out. You don't want to be. So if you're in the small percentage that doesn't want to be an organ donor, you get to opt out. The rest of us are just assumed you're going to be an organ donor. Now we have the infrastructure in parts to make sure that happens.
Premier McNeil, I do have a question just to follow up on that. Not all provinces in Atlantic Canada or throughout Canada have mandatory referral in the ICUs, ERs, and in the hospital system. How integral of a part do do you feel mandatory referral is? Because Nova Scotia does. So that's when a person meets the criteria that indicates they may be a possible donor and end of life discussions have started. Right now in Nova Scotia, with your legislation, it's mandatory that they be referred to your organ donation program. How integral is that in your view?
I think it's certainly an important part of it. I would argue it's number two. And number one is the different conversation that happens at the bedside, and what's happening in rural communities, because even if that referral happens and we make it happen, unless we've done the, and this is Dr. Bede still ringing in my head, unless we've done the work behind before the incident happens, it doesn't matter if it's mandatory referral because we can't do anything. You know that, and as somebody who, as I said earlier, had always signed my card to be an organ donor, I was shocked that the odds of me being one, a year ago, even though my desire was to be one, weren't that great because of where I lived. So I think that mandatory referral is an important one, but as well, and I would say, and I've said this to premiers as well, find your expert in your province and then do the due diligence before you adopt of how do you make sure that the desire of your citizens is going to be fulfilled and that the infrastructure is there to do it, and that you've made this, the conversation with that healthcare team with somebody much easier. I couldn't imagine having to go have that conversation. Yeah. Margaret Miller lost her son, and somebody had to go tell her or ask her at that moment in time, and she happened to be a place where someone said, you want to donate Bruce's organs. Yeah. Now, if you're in communities across this country, in this province, and as I said earlier, small ones, everyone would know my family. They would know my two children. They would know Andrina. That's a burden to be placed on somebody, to have them come and ask in our family's weakest and most heartbreaking time. Yeah. So this conversation is a different one. And I really believe, and I believe, we're talking about transplants. This is about putting the heart into this conversation.
It is, and Premier McNeil, one of the things I've really appreciated and respected as this has been rolling out over the last year and a half is that always I've heard the message how important it is to speak to your family, make organ donation a supper time conversation, so to speak. And you hit the nail on the head when you spoke about that family, because if we have that conversation and we know you don't have to make that decision at your most vulnerable time, you've already had it made, and you're comfortable in knowing you're respecting your loved one's wishes. And that is a key part of this all throughout what we're doing for organ donation promotion. I think one of my key messages every time I speak to organ donation is really ensure that your family knows what you want to do.
It's amazing, isn't it? And I keep talking about Margaret because because it's such a that's what happened to Margaret and Bob. They didn't know Bruce's wishes, but they made the decision. And it was sometime later that a very good friend of Bruce's told them that was what he would have wanted to happen because they talked about it. It lifted a level of heartache off of Margaret and Robert in lots of ways. And so to your point, if we have this conversation, we already know. I know the desire of my children and my wife, and they know mine. And so that makes it just I think what you're saying, as hard as that is, and hard as that will be to make that decision, there is something knowing that you fulfilled the wishes of the person you care about and love.
Mr. Premier, I'd be interested with this being the first jurisdiction to try something like this. What kind of feedback or questions or ideas you're getting from not only other Atlantic Canada premiers, but across the country in North America? You're being watched by a lot of people. What do they want to know from you?
I'm used to being watched. I'm glad it's for a good thing. You know what? It was on the very day that we announced. I got a call and a text from Premier Moe, Saskatchewan. This is on his mind, and it had been on their mind. A lot of it was somewhat related to the tragedy of the bus crash with the Humboldt Broncos, and just I think from I heard from other premiers, the coronavirus I think has slowed down this piece of legislation being introduced, and I believe it will happen in the country, and I think most of, if not all of our jurisdictions will adopt this, especially since what's happening here is starting a national conversation about it. There's been lots of positive things come out of it. There was lots of questions here too, but you can answer those questions about making sure you respect the wishes of those who want to opt out and all of that. But you know what? When there was never a call, I have not received a call saying, "What were you guys thinking?" It's been a call of, "Can you tell me more? Who can we get in touch with?" And we really, and I say this to politicians, and because I'm one of them, you should always have expert advice, but this is one of those times where you go to your own transplant teams and you build it out. The easiest part is the legislation. How do you build out from there? And just making sure that you have the infrastructure to do it. And I do believe it will happen across the country.
Can I ask what you personally call a success? Is there a measure that this legislation and future process are changing the number of transplants from this number to this number or this percentage? Do you have a sort of a number in mind of how much by when type thing?
No, what I have in mind, what I would consider success is that the conversations are happening at home, that our wishes are being fulfilled. I think the number will be a byproduct of that. That will be where we need to continue to have this conversation about. The legislation is just one aspect of it. We need to make sure that this is on the forefront of our minds, and we know what our children and what our spouses want and what our siblings want, and then make sure we continue the educational component for healthcare teams to make sure that wish can be fulfilled no matter where you live. And the first day I met with Dr. Beat, I said, I'm tired of bearing hope. In essence, that's what I believe we do when we don't actually provide and fulfill the wishes of individuals and provide someone waiting for a life-changing organ. And I'll show you some of my ignorance. When I started this, I had no idea how many people were waiting for tissue. No idea. And how many people's lives can be changed by that single act of a donation of tissue. It's extraordinary. So we're all learning. And that's the beauty of this. And you know what? It's just, I've lost people in my life. It's hard enough to lose somebody. But, when you're at that moment where you can say, wow, wouldn't my loved one be thrilled to know that from them, life continues for others? It doesn't get better than that, really, in lots of ways.
Mr. Premier, in conclusion, of course, this is being broadcast to many members of our kidney community. You mentioned people on dialysis, people waiting for transplants, hoping for transplants. Is there any particular message you'd say in outreach to our kidney community about what you're doing here?
Don't give up. Keep hope. Keep looking to the future. We're with you. This is about you. This is about ensuring that we're doing everything we can to provide you with the life-saving and life-altering operation and donation that you need, and continuing to add your voice. All of us, the human story, both in its success and in its challenges, inspire us. And for members of your organization, those who are on dialysis, continue to tell your story to remind us why it is so important. And know that the vast majority of the people in this province, if something happens to them, wants you to start a new beginning.
Premier, thank you very much. Congratulations on being recognized in our reward, and thank you for your time today.
Well, I'm honored, but I as you know, it's more than me. I was pleased that we had unanimous consent in the legislature, which doesn't happen often. And the healthcare teams who were, I think, inspired by the patients, by people who were waiting for organs and tissue donations, and they were inspired by it, and they embraced the idea and ran with it. And so I'm grateful for being honored, but I, as I said that night, I accept this on behalf of all Nova Scotians.
Thank you for your time.
Thank you.